one home fire can unfortunately fill our unit. Day to day, we usually run somewhere between 10 and 20 patients that are burned in the burn center, and that includes from birth, so children, no age minimum, on all the way up to, well, we've noted that we've had quite a few patients over the age of 90 in the last few years.
One burn patient will see 7 team members a day minimum. So that's nursing, that's psychosocial, either the social worker or the psychiatrist. That's the occupational therapist that's going to help you learn to brush your teeth and comb your hair. The physical therapist that's going to walk you around the unit. Often the child life therapist if you're a child, or sometimes if you're a parent, the child life person will help you with that, and our chaplain. And that's just in one day. And that's not counting the doctors. So that was 7 people that aren't even the doctors.
You leave the burn center when you leave the hospital. In general, there isn't a sicker place for people like you, a place where they're cohorted with sicker people until you're well, and then we bring you back, and then when you're this good, we send you on. The burn center takes care of you the whole time. The whole time. We'll have people with significant injury here for 100 days. You have to leave the hospital in your skin. So I'm going to try wherever possible to have your skin heal itself, create an environment and not touch it surgically. As you can imagine, if I have a burn that's just, say, my arm, it's not such a chore to go get enough skin to cover that arm. Now it's both arms. Now it's both arms and my whole front of my chest. The areas to take skin from start to decrease. You know what I mean? And so I can put skin from another person on, but it's temporary. And so I've eventually got to cover you entirely with your own skin. The larger the burn, the longer the time to coverage, the greater the scarring, the greater the deformity. When a home goes on fire, as you say, I would say it's altogether common in a true home fire that we see an inhalational injury with it. And we know that, for every inhalational injury, the mortality is up. So if you have a 40% flame injury from a house fire, but you don't have much of an inhalational injury, you're going to do way better than if you also have an inhalational injury. And in medical school, we learn that the lining of the inside of your lungs is the size of a tennis court. So picture this giant tennis court, and now you're walking around on the tennis court with like a thing of soot, like a shaker. And you're just shaking it all over that slowly, and they just let you stay there and you keep shaking it. So that whole tennis court lung gets inflamed and thickened. It gets harder for oxygen to get through it, and harder to breathe, such that many inhalational injuries we can't manage without the ventilator. During my training was the first time I saw it. Was a woman, dad's at work, they were from the Bronx. They had an apartment, two-family house. The first floor was a place they rented out. Mom is home with 3 children. When Dad came home, the fire department was already there. The fire was in the rental unit downstairs. All 3 children were gone. And Mom had, significant inhalational injury, so she was with us on the ventilator. But then when she came off the ventilator, she also had surface damage, so she had a body change. And that was the case for me that showed me the power of burns. So I had thought that, a family in a minivan, being hit by a tractor trailer truck was the worst thing that could ever happen. Until I saw the children, by this house fire gone, the mother recovering from a horrible illness with tremendous scars, and everything gone. All the memorabilia, all of the, pictures from holidays, things they had written, everything from those childhoods was wiped out.